Hello everyone, welcome to the recall session of Pharmacology. Now I'm sure you are all well rested. I would request all of you to please help me with the framing of the questions. Now from whatever I could gather from all the messages that you guys have been sending me, I have roughly prepared a draft like questions and we can always polish them and make them better for the coming batches. And this is a chain, like you help these people and obviously you will be blessed as well, and somebody in your senior batches have helped us recall the questions and that might have helped you in solving the PYQs. So please make sure you also do the same. Thankfully, God has been very kind to us that most of the questions are those that I had discussed in the 25 most important question series, and obviously some things that I might have make you mark during the classes that this is expected. Without any further ado, let's begin the discussion. So here's the first question. A person taking anti-diabetic drugs goes to the gym and while exercising suddenly collapses. The glucose level is 60 mg per deciliter. Which of the following drug could be associated with the presentation? Now, this is a straightforward thing. Like, why would suddenly somebody collapse? See, there is a hint that is given in the question. They have told us that this person is a diabetic person. So he might be taking diabetic drugs. A very simple logic that you need to apply here is patients who are taking diabetes drugs are at risk of hypoglycemia. But technically, not every drug does that. So obviously you need to keep in mind which drugs causes hypoglycemia, and that's the answer here. See, the glucose level was also mentioned that it is quite less. So from the given options, sulfonylureas is the correct answer. And guys, you need to understand something. I'm not sure if sulfonylurea, that is the name of the class that was given, or they had given the name of the drug itself like glimepiride, etc. So those drugs, whose names start with GL, these are second generation sulfonylureas and they're very commonly used drugs. So this is the correct answer for this. Although we have the drug of choice called metformin in the option, that's not the correct answer. As you can see, just in my last 25 important question series, I had a question that was exactly on hypoglycemia risk. Although my question, I was asking you the insulin which has highest risk, they just asked the same topic but with the name of the drug. Another video of 25 important question series, I have very clearly mentioned this. You can see the first line itself is the drugs that cause hypoglycemia. That means it's a straightforward question. If something is there in 25 important questions, that means it's highly, highly important. So question number 2, which of the following medications increases the chances of chlamydia infection with history of vesicovaginal fistula? So technically something might have been given with genitalia and they're just asking us this one thing, that is there was an increased risk of chlamydia infection. Sir, you must know that organisms, they like glucose. Just like we consume glucose for our energy, they also consume glucose. So the thing is that if you're putting too much glucose into the urine, then there is increased risk of infections because you're providing them with glucose. And these drugs are nothing but SGLT2 blockers. The examples are gliflozins. Now there is this mnemonic that I always teach. So the correct answer for this is gliflozin, no doubt about this. I don't know which option was given. Was it canagliflozin, dapagliflozin, whatever, right? Gliflozin is the answer. This 25 important question series, again, we have very clearly said glucose flows in urine. If you have watched that video, I very clearly said that because of this, there will be glucoseuria, and glucoseuria can increase the risk of infections, right? Example like UTIs, etc. So there we have it again. Next question, another question from diabetes again. A patient underwent a GI surgery and jejunum was resected. Which of the following drugs would be added in the treatment of this patient? Now, this is something you need to apply little bit of your mind, right? Please correct the options if you remember them, but the correct answer will not change here. The correct answer to this is going to be teduglutide. Now, what exactly is happening here? What is this case? Doctors, please remember that the GIT was resected. That's what is being mentioned here. Yes. So that means the person's bowel must have become short. So this is a classical case of what we call as short bowel syndrome. Short bowel syndrome. Are you understanding that? And for the short bowel syndrome, we use these drugs called GLP-2 analogs, GLP-2 agonist or analogs. The remaining drugs are also having this tide type of a name, in fact glutide also, but they are different. These remaining drugs that you can see that I have marked just now, they are all GLP-1 agonist. All right. So GLP-1 agonists are mainly used in diabetes topic, and GLP-2 agonists, they're used for short bowel syndrome. This is just a screenshot from our class notes. In fact, I have marked it that this is a new drug. In fact, there is another new drug now, tirzepatide. This is also expected, especially in the NEET PG INI set type of exams. Okay, so anyway, teduglutide, short bowel syndrome, expected question, as you can see that I have marked during my classes. So next questions, doctor. A patient presents with hypertriglyceridemia. Which of the following is the best drug to reduce triglycerides? See, the best drug to reduce triglycerides are nothing but fibrates. Okay, fibrates. See, previously also there was a question on fibrate. They have asked the mechanism of action of fibrates, which is nothing but it stimulates one factor called PPAR alpha. So that was a previous question. Now, once again, something like that can be repeated in the coming exams. So once a topic is asked in exam, make sure you all read it well. So sir, fibrates, that is the correct answer. Another question is, a patient is on the medicine to lower the LDL cholesterol. Which of the following is an add-on drug to increase the HDL? Good cholesterol called HDL, if you want to increase, then we should add a medicine by the name of niacin. Niacin is the drug that you have to add to increase the HDL. It is one of the best drugs to increase HDL. But once you give niacin, there can be certain side effects because niacin increases prostaglandins. And once prostaglandin increases, they causes side effects like flushing, pruritus, etc. So to reduce the side effects of niacin, we give one more drug called aspirin. See, this kind of questions are once again anticipated. So aspirin is always added with niacin. You can remember like that. And here we go. There we have it once again. 25 important question series. I have talked about this lipid specifically, right? As I told you, God has been very kind. Like whatever we are discussing in the 25, at least some questions will show up in your exam. So here we are. Best drugs for reducing LDL is statin. Best drug for increasing HDL is niacin. And one for reducing triglyceride is fibrate. As a matter of fact, some of the students have messaged me, sir, there was a question on this monoclonal antibody that we have discussed. I'm not sure if it was, please let me know, right? Maybe the mechanism was given and the drug was asked. So I told you this is a drug that lowers cholesterol. Next, a question from anti-cancer drugs. Which of the following is associated with hand-foot syndrome? So guys, many of the students were confused in this question, although this was quite simple. A lot of them were telling me, sir, they asked the drug about hand-foot-mouth syndrome. Guys, there is no hand-foot-mouth syndrome. There is hand-foot-mouth disease that is caused by a virus called Coxsackie virus, Coxsackie A virus. All right, that is a different thing. In fact, in my classes, I used to ask you this question, like, when we discuss this side effect, I used to ask you hand-foot-mouth disease is by which virus? Obviously, most of the people who attended the classes, you might not have made a mistake there. So this is a side effect which involves the skin in these areas. It's a side effect that involves the hands and the feet. And this is basically the side effect of the drug called 5-fluorouracil or capecitabine, right? It is the prodrug of 5-FU. So technically, you understand one of this option must have been given. This is the correct answer. Why to go far? You may have a look once again. From the anti-cancers, I told you the side effects are very important and their antidotes, if they're available, they're very important. You can see within this list right here, hand-foot syndrome, 5-FU or capecitabine. All right. And another MCQ came from right here. If you watch this video, I might have explained this, that methotrexate, the antidote is what we call as folic acid or folinic acid. You can see right here. Okay, folic acid. The question is, why do we give folic acid as an antidote for methotrexate? The mechanism of action. What does methotrexate do is, methotrexate reduces folate. The more methotrexate you give, the less the folate will become. That means in methotrexate toxicity, the antidote is folate. Why? Because it reduces folic acid. And how exactly does it reduce the folic acid? It blocks one enzyme. I used to tell you this is the rate limiting enzyme of folate synthesis. It's called as dihydrofolate reductase. Dihydrofolate reductase. That is your next MCQ that they ask from the anti-cancer drugs. What is the mechanism of action of the medicine called as methotrexate? The answer is going to be, it inhibits dihydrofolate reductase. Okay, so straightforward question once again. Which of the following anti-cancer medicine is used for the GIST or CML? I don't know which of the two was asked. Some people were saying CML. So guys, imatinib is the answer for this. In fact, I told you tyrosine kinase inhibitors that end with tinibs, there are many of them. But if at all they will ask you something in exam, they will ask you imatinib, I told you. This is one of the first few tinibs that were created. That is something I had marked during my classes also. Although there were many others, I told you the chances are less for the others being asked. But please do know imatinib for CML and for GIST. What is the preferred treatment for the organism shown in the image? Guys, I'm sure you know from microbiology that this is nothing but banana-shaped gametocyte, which is a classical feature of Plasmodium falciparum. And guys, for the Plasmodium falciparum, the treatment that we prefer is known as ACT. Okay, artemisinin combination therapy. Now you must know that the treatment of ACT is different in northeastern states of India versus remaining India. I'm zooming into these two things. I have discussed this recently only, right? This video is also available on YouTube. You can check this out. We have discussed the treatment of malaria, both related to Vivax as well as falciparum, that too not just in normal people, but even in pregnancy. Next, another place you can see I had talked about this thing because some people told me that they've given the image of gametocyte, then they asked the treatment. So sir, this is also available, banana shape. There was a mnemonic in fact that I told you that falciparum is the one that causes more serious disease. That means it makes you more sick. So you got to remember the mnemonic. It makes you more bimar. And you can see right there all the important features that will be tested in exam. So there we have it. Ye bhi something that came from 25 important questions. Next, a drug that can be used both in HIV as well as hepatitis B. All right. So guys, you got to remember that from the given list, one drug called tenofovir. This is the guy that is used for hepatitis B. Apart from HIV, it's also used for hepatitis B. See, there was a hint I used to give you during classes. If a drug generally, has avir in the name, it has avir in the name, I told you those drugs are used for AIDS. Okay, they're used in HIV. Then I told you that if a drug has ivir in the name, those drugs are used for influenza virus. And then if you see ovir in the name, I told you that ovirs are the drugs that are used for herpes, with one exception. See, acyclovir, ganciclovir, they're used for herpes, with one exception I used to tell you, and that exception is tenofovir. Why did I teach you that exception? It's used for hepatitis B as well as HIV. As a matter of fact, it is one of the best drugs for hepatitis B treatment. Okay, there is a formula called tenofovir alafenamide, that is what is used for hepatitis B treatment. And once again, this is nothing out of the box. You can see right here from our notes. This is a screenshot. So in the HIV treatment, one of the last, things that is written is this only, right? Tenofovir, this is the drug that we prefer here. Next, what is the best treatment of a patient having diarrhea with a flask-shaped ulcer? All right. So you might need to first identify what are they talking about. If they're talking about a flask-shaped ulcer, it's a very classical thing of the organism or a parasite called as Entamoeba histolytica, the one that causes dysentery, amoebic dysentery, bloody diarrhea. So guys, for this Entamoeba, the drug of choice is metronidazole. How do you remember this? Do you remember the mnemonic I used to teach during classes? This is get on metro, get back on metro, if you want to remember, right? So the E there is Entamoeba, Giardia, Entamoeba, Trichomonas, Gardnerella, all these things we used to learn. So metronidazole is the drug of choice. That's it. All right. I hope everybody is clear with this question as well. A patient on metronidazole therapy went to a party, consumed alcohol, after which nausea, palpitation, flushing, hypotension, etc. started. What is the most likely diagnosis? I won't tell you the diagnosis. I will show you the diagnosis that we discussed during our last 25 important question series. Same question came in your exam now. This is nothing but disulfiram reaction, a classical presentation. They show that somebody drank alcohol, so that means something is happening. This is nothing but disulfiram. Two things can happen. If they're mentioning somebody drank alcohol and their BP went up, then that is cheese reaction. And if they're saying that some other things might have happened and they're mentioning antibiotics, etc., then that is nothing but your disulfiram reaction. And I discussed which drugs can cause disulfiram reaction. One of the drug is metronidazole. So my question was, these three drugs causes disulfiram reaction, except which one does not cause ampicillin. Okay, so done with this. Next, which of the ATT drug is associated with visual disturbances? A very classical easy question. The answer to this is ethambutol. E for eye side effects. You will be bored of me showing these things. You can imagine why are these things so important to see just before going to the exam, right? So E for ethambutol discussed before, and you can see once again ethambutol. I told you eye related side effects like optic neuritis, etc., etc. A patient with a history of myocardial infarction has developed acute attack of migraine. Which of the following needs to be avoided? Please pay attention. Which of the following needs to be avoided? So, sir, I don't know if they ask you the treatment of choice or if they ask you the one to be avoided. I'll give you the answer for both. You can decide what you have marked. Sir, please remember that triptans are the drug of choice for acute attack, especially the severe attack. Although you can use NSAIDs, etc., but triptans are the best drugs. Okay. Triptans, although they are drug of choice, they are contraindicated in coronary artery diseases like MI. All right. So I used to tell you that triptans should be avoided if the patient is having history of this. Then can you treat these patients by some other drug? Sure. There is a drug called lasmiditan. Another direct question from our series. You can see right here. First of all, in this case, I have given you a case scenario to diagnose migraine. As you can see in the real exam, the questions these days, first you have to diagnose the disease, then you have to know the treatment. So that's why in all my series, I've always given questions like this only, right? So you can see coronary artery disease is there. Now, all of the following can be used in the management except. That was my question. All right. Triptans cannot be used in the coronary artery disease. So what is the drug you can use? Lasmiditan. I used to tell you a mnemonic, less MI risk is present with lasmiditan. So that's it. Very straightforward thing right here. Next, a patient presents to the emergency department with a blood pressure of so-and-so, very high blood pressure obviously, and there is even presence of headache, seizures and blurred vision. Which of the following needs to be used in the management? Doctor, first of all, you must analyze something. Whenever there is an emergency, you should always use IV drug. The moment I said IV drug needs to be used, I think two options will be ruled out already. अब बचे दो drugs. The two drugs that I have left is IV labetalol, IV hydralazine. Technically speaking, both of them are used in hypertensive emergency. But a better drug is always labetalol. Okay. And if pregnancy word was mentioned, like I would close my eyes and I will choose IV labetalol. Okay. But even if it was not mentioned, in my opinion, you all should have marked this as the answer. Although nicardipine is mentioned, nicardipine is the drug of choice in emergency, but we won't give it oral, sir. IV. We need fast action. So nicardipine is given IV as well. So labetalol is a better answer here. This is a list when it comes to hypertension. I asked you to remember, especially the emergency. We have very clearly discussed emergency normally and in pregnancy, which drugs to be given. Okay. Next, which of the following is the mechanism of action of apixaban, or I don't know, whatever the exaban they asked? Quite an easy answer, sir. It inhibits factor 10A. Okay, something from our notes very clearly. I used to always tell you how to remember this. Factor 10 produces a clot. So we are creating drugs called anti-clotting drugs, anticoagulant drugs. That means we will be blocking this factor. So factor 10 blockers are called exabans. Ban means blocking something. Exaban. XA ko ban karne wale. That's it. And the antidote also have the XA in the name I used to tell. So that's it. Next, DTI. I'm sure everybody from my class at least remember dabigatran and its antidote. Although the name is so bad, yet we remember idarucizumab, right? This also, like especially anticoagulants case we have discussed. See, I'm not saying that every time the same question I'm discussing will be there in exam. That topic is important. So definitely something in and around that can be asked. Last FMG, we were lucky enough, they asked the literally same question. Pregnancy mein which drug anticoagulant is used? Ditto, pretty much same question was asked. But this time a little different, exabans. Very easy again. Now guys, don't think when I say easy, just because I am a faculty, to me everything is easy, I'm saying that. No, these are genuinely easy questions. Some of them which are tough, I myself will tell you, yes, this was a tough question that was asked in exam. So, a patient was given anesthesia for a surgery. What is the drug used in the management of post-operative muscle paralysis? Guys, one of the first chapters when we study, we used to tell this. Usually, there are some skeletal muscle relaxant drugs called curator drugs or curarin drugs. Example, atracurium, the one that shows that Hoffman's elimination. Atracurium, etc. They are skeletal muscle relaxants. Now imagine somebody gave too much skeletal muscle relaxant to someone. Their skeletal muscles got relaxed. What are we going to do in the treatment? Contract them back again. And for getting them back again, curate toxicity is treated by stigmine drugs. And with stigmine specifically, I used to teach you, it is neostigmine. The correct answer to this will be neostigmine, dosto. All right. So this is one question. Probably this was discussed to you in anesthesia as well. But again, from pharmacology, what came, I'm just discussing it here. There was one more drug, right? Ketamine, that was also a question. NMDA receptor blocker, that is ketamine. Next, which of the following is the mechanism of action of ethosuximide? Doctors, when we learned epilepsy, you can look at the first page of the notes itself. Like we have learned, we are going to block certain ions in the epilepsy. And a drug that blocks mainly calcium channels only, it is a drug called as ethosuximide. And we use ethosuximide in something known as absence seizures. All right. So this blocks the T type of calcium channels. See, you must be knowing there are two types of calcium channel. One is L. L is present on heart or blood vessels, other places. T is thalamus. It's present in the brain. All right. So basically, this is the one we are blocking by ethosuximide. Mechanism of action of local anesthetics. See, anesthesia means blocking sensation. I've explained this concept to you during classes also, that if you are blocking sodium entry, sodium is the one that causes depolarization. Depolarization means sensations. But if you block the sodium entry, then what will happen? There will not be any sensation, and that is nothing but anesthesia. So these cane drugs, lidocaine, etc., how do they work? They block the sodium channels, doctors. They're going to block the sodium channels. That's all that you got to know right there. Next, which of the following drugs is used in GERD? Sir, in GERD, you got to remember that there are two things that we want to do. All right. One thing, we want to reduce the acid, okay, for which we can give drugs like PPIs. This is one thing. And second thing, we use certain drugs, what we call as prokinetic drugs. Prokinetic drugs. See, we took a typical example of our clinical practice. We all know one brand name. There are many brands. I'm not promoting any brand here. I'm just saying, like, as doctors, we all know there is a brand called Pan 40, Pan 20, whatever. Pan means pantoprazole. That's the brand, right? And then I used to teach you that there is a variant called Pan D as well. What is present with the D? Domperidone. And what is that domperidone? It is a prokinetic drug. Prokinetic drug. So doctors, like, if at all they asked you this question, I'm not sure how this question was exactly framed. See, if I were you, then I would have chosen this as the answer. The prokinetic drugs are metoclopramide or domperidone. Okay, so probably one of this should be the better answer. Okay. A patient was admitted with complaints of tachycardia and arrhythmia. Physical exam shows scratch marks over the body. Which of the following is the patient most likely on? Sir, this is one concept that needs to be present in our brain lifelong. That sympathetic system increases heart rate. Sympathetic means when we are in stress. When we are in stress, our heart rate increases. You might have felt this right before entering the exam hall or probably throughout the exam itself, right? Our heart rates increases. So, sir, how does this guy work and who is this we are talking about? Look at this. Imagine the synapse, right? This space in between here is called as synapse, between the receptor and the nerve terminal. So doctors, you can remember the neurotransmitters that are released like noradrenaline, dopamine, etc. They're supposed to go back by a process called as reuptake. But if you stop them from going back because of using some medicines, they will increase in the synapse. And these are sympathetic neurotransmitters I'm talking about. And obviously they will increase the heart rate by working on the respective receptors. And this drug who blocks the reuptake is called cocaine. The first local anesthetic known to us was cocaine. And I might have told you this, that the people who use cocaine will start imagining that some insects are crawling on their skin. Okay, tactile hallucinations or malignant symptoms. So basically they're mentioning very clearly here there were scratch marks over the body. Which of the drugs the patient might be abusing? So obviously the answer here is cocaine. Okay, see, heroin, if they wanted to tell you, heroin is an opioid, and opioids would have presented with pinpoint pupil, respiratory depression, that kind of a presentation which we learned during our class. Datura to datura. Datura is nothing but the guy that will reduce parasympathetic activity. It would present with constipation, blurred vision, etc., etc. Cannabis, I don't need to teach you anything about this. So anyway, you know it, that cannot be the answer. So cocaine. Cocaine is the correct answer for this. I don't know how the examiner was so kind. If the question was really like this, so simple, or it was a big case scenario and one line was questioned like this. But either ways, they asked this, right? Which of the following vitamins is used, to prevent the NTD, neural tube defect? Sir, obviously it is folate. And what is folate? Folate is B9. Okay. So technically that is the correct answer for this. All right. So ye vitamins you got to remember: niacin, thiamine, hydroxycobalamin, or this thing that is called as folate. So folate is used to prevent the neural tube defects like spina bifida, etc. So one question, obviously, in delirium, when a patient is in delirium, we need to give them a sedative to calm them down, and that drug is lorazepam, drug of choice. If this was mentioned in the option, then this has to be the correct answer. Okay, I don't have the other options, so that's why please feel free to, type the question number and the options if you remember, or the correct framing also. All right, that's my humble request to all of you. A drug used to test for the myasthenia gravis. Once again, few people told me, I'm not sure if this was a question that was asked, but if it was asked, it is tensilon test that they're asking about, and the drug for tensilon test is edrophonium. Edrophonium, something that is again discussed during our 25 important question series. Next, I was told that there was a question on competitive inhibition graph. So, Sergi, I'm not going to re-explain this again, but you can see I've told you इस पे question आएगा either competitive or non-competitive. In the competitive, you can see I have shown very clearly the graph will shift towards the right, and in non-competitive there will be shift downwards. Okay, effect of one will decrease. All right, and mnemonic भी दिया था मैंने how to quickly realize by looking at the KM etc. Okay. Now, which of the following is the use of topical mitomycin C? All right. So, this is an anti-cancer drug which is used for subglottic stenosis. I'm not sure if this was the exact option that was given, but something of this sort was asked, that was told to me by a couple of students. All right. So, I'm not saying all of these might have been asked, but at least 20 questions to ho chuke hain, which were definitely questions in our exam. Now we're just moving further and further. Now we're at the question number 27, right? You all have seen that the paper 1 and paper 2 had, quite a decent amount of pharmacology questions. Graph for isoprenaline. Once again, please help me out. This is the exact words I was getting from students. Sir, kuch graph diya tha based on isoprenaline. I don't know, based on that I cannot predict, but you can see in the last discussion I have talked about this, something that can be asked, what happens to the blood pressure and the heart rate? Exactly, isoprenaline, adrenaline, that's the thing I have discussed, noradrenaline. So probably it was one of this that they have told what happens to the blood pressure and the heart rate when it comes to this. Next, was this a question? You need to just tell me emergency drug that will be given to a girl after unprotected intercourse, right? So emergency means within the 3 days you have to take this drug called levonorgestrel. As I told you that some students were telling me that there was a question on either this or ezetimibe. I'm not sure. This is one of the cholesterol drugs again. If at all this was not asked, let's strike it off. It doesn't matter. Once again, I'm just putting those lines here that were told to me by students. If at all this was a question, then please feel free to fill up these options and how the question came. Answer would be tropium drugs. Tropium drugs would be better. Ipratropium, tiotropium like drugs. That would be the correct answer here. Another thing, something related to haloperidol, people were saying they were not able to recall, I guess, the full thing. Was it related to extrapyramidal side effects or their treatments? Okay, once again, a doubtful question. Anyway, a decent amount of questions, at least 25 we can say, that were asked from pharmacology. There might have been some questions that I'm still missing here because they were not still recalled by students. So whatever it is, one thing is very clear, that you got to study the basic subjects. Now that they're doing one thing, it is they are giving questions from some clinical subjects, and in the end the question will change to some basic subject question. It will describe a case from internal medicine, suddenly they will ask patho question. They will ask something from medicine, in the end they will ask you the treatment, pharmacology mechanism. So things like that. Now you need to build up your basics from the beginning. Gone is the time when we would just blindly memorize some things and we will be going to exam. Gone are the times where we will just select certain subjects, cherry pick them and pass the exam. So as much subjects as you know, the basic knowledge as you have, it will be better. And in fact, you've seen that paper 2 questions, the way they're doing is they're giving more clinical types of questions. That means we need to step up our game. All right, you guys are more than capable of doing that. So basically that's it from my side. Please follow me on these channels, that is on Instagram as well as on my Telegram channel. You will be getting questions and a lot of things because your journey does not stop here. You still have to do your NEET PG or any exam that is coming up. So the content related to that would be obviously there on my channels. Wishing you all the very best. Now you guys literally deserve to relax for a bit and enjoy as many things possible. TV series coming up, whatever it is. Now you can watch all of them and update me what is happening. If there is any good TV series or movie you have watched, please let me know and I will also enjoy that. Okay, so thank you very much. God bless you all. Take care, everybody. All right.